Is that
Women are not
a
politically
optimistic view?
interested,
It's
yeah.
the sense of like
Welcome back. You're watching another installment of Let's Talk, the video interview series hosted by the Singapore Democratic Party. I'm Nadine Keller and I'm looking forward to another informative episode. Today we have with us in the studio Associate Professor Paul Tambyah. Associate Professor Tambyah is a graduate of the NUS Medical School where he obtained both his MBBS and MD degrees. He did postgraduate training in infectious diseases at the University of Wisconsin and has served on a number of national and international committees, including the Board of the Society of Healthcare Epidemiology in America and the Council of the Western Pacific Committee on Clinical Microbiology and Infectious Diseases. He's currently in academic medical practice at a major teaching hospital in Singapore and is one of the region's foremost infectious diseases specialists. Professor Tambyah, welcome to Let's Talk.
Thank you. It's great to be here.
You caused quite a stir last year when you publicly endorsed the SDP. You held a lunchtime rally during the GE period, too, I believe. What made you do it?
Well, I spoke at the SDP lunchtime rally at Boat Quay, and I really enjoyed the experience. I can tell you, like many Singaporeans, especially those in healthcare or education, I was not happy with many of the things that were going on in Singapore in the education field as well as in healthcare. And I had tried many times to give feedback through official channels. In fact, I was the first doctor to post on Minister Corbin Wan's Facebook page. I even went to a Facebook session on a Sunday afternoon in the pouring rain way out in Yishun, despite a family illness, because I was not happy with some of the things that were going on with means testing and with payments for non-standard drugs. But all of the answers I got were very unsatisfactory. And in fact, it seemed to me that these feedback sessions were nothing more than sessions to just try and pacify the people. And I realized that if you genuinely wanted to give feedback, you actually had to get involved with some of the alternative parties. And the SDP seemed to be the party that was closest in line with my own personal political philosophy, which is slightly left of center. Interestingly enough, I had been appointed the distinguished alumni professor, and I gave a talk in November. Dr. Wong Wee Nam was at the talk, and after the talk, he came up to me and said, "You speak pretty well. Would you like to speak at one of the rallies?" So I said, "Sure," and that, of course, was the opening. I also felt that, I had enough of just sitting around tea rooms complaining about education and complaining about the healthcare system, and it was time to, speak up. And it was a great experience actually being at the rally. It was a place that was so rich in our history, and sharing a stage with so many dedicated people who care so much about Singapore. One of our junior doctors actually videotaped the event, and it went viral. And that was really nice.
Has politics always been in your blood? For example, did you come from a politicized family?
Well, my parents have been very apolitical, but on the other hand, they both had very strong values, which they inculcated in both my sister and myself. My father passed away last year, but all his life he spoke up for the less fortunate. And he did more than just simply treat poor patients for free. He actually wrote about some of his concerns about the healthcare system, to senior people, and he was very concerned about, in particular, about the commercialization of the healthcare system in Singapore. As he was a very respected clinician, he was often invited to panels where his views were valued. He knew Dr. Lim Hock Siew very well, and in fact, as a child, I must have met Dr. Beatrice Chen, Dr. Lim's wife. Of course, I could never have met Dr. Lim Hock Siew. He was in prison at the time. My mom is even more of an activist. She's a professional social worker, and for the last 50 years, she's been a tireless advocate for the disabled. She's one person who's a real doer. If she sees a problem, she'll roll up her sleeves and she'll start doing something about it. She'll mobilize her friends, people she knows, and she'll start badgering the authorities into doing the right thing. For example, I'm not sure if you know this, but many years ago, ambulances run by VWOs had to pay a COE, which tremendously increased the cost of running these ambulances. It was her considerable lobbying that actually resulted in that decision being rescinded. So now ambulances do not have to pay COEs. Her current passion is trying to get disabled children included in the compulsory education legislation. This is something that the parents of disabled children want, and in fact, a broad spectrum of VWOs also want that too. But somehow the government has been reluctant to do that, and I think it's probably because of costs. So both my sister and I couldn't help but be influenced by parents who care deeply about Singapore and Singaporeans in need.
What made you decide that the SDP was the party that you wanted to support?
Well, like many Singaporeans, I'd been exposed initially to all the negative portrayals of the SDP in the mainstream media. However, with the advent of the internet, I finally got a chance to hear directly from them and from Dr. Chi. And I found out that instead of being some crazy bunch of people who are, full of out-of-this-world ideas, that they really were a group of passionate individuals who sincerely believed in an alternative path for Singapore. The SDP and Dr. Chi have always stood up for Singaporeans, giving Singaporeans a chance to speak on issues that matters to us. I'm sure you know that Speaker's Corner is directly a result of Dr. Chi's activism. And so many people have benefited from that, even the uncles and aunties who invested in Lehman Brothers mini bonds. The SDP has also spoken up on cost of living issues with the Tak Boleh Tahan campaign, on the death penalty, Muslim schoolgirls, and so many other issues which are often unpopular, but Singapore really needs to deal with if we're going to progress as a nation.
You are an establishment figure. Traditionally, the establishment has tended to shy away from partisan politics. Why do you think that is, and why did you break the mold?
As you know, Singapore has the most highly paid politicians and civil servants in the world. The reasons for this have never been satisfactorily explained. The results, though, are obvious. The public expects our ministers to be 5 times as good as Barack Obama, or 10 times as good as Angela Merkel, or 100 times as good as Hu Jintao. But we are told that we have to manage our expectations. The reality is the establishment in Singapore is very comfortable. We have excellent infrastructure. We have well-trained staff who are willing to work long hours at relatively low wages. And we get to travel all over the world because we speak English well and have a good story to tell about how things work in Singapore. Actually, Dr. Chi's experience has frightened many people from the academic and administrative sectors from speaking up. At one fell swoop, a promising young academic is turned into a bankrupt, reduced to selling his books and doing freelance neuropsychological work. One of my guiding principles, however, has been a saying from the philosopher Diogenes. Apparently one day he was preparing lentils for dinner, and his friend Aristippus came by and said to him, "Why are you doing that? You should learn to flatter the king, then you won't have to eat lentils for dinner." Diogenes responded by saying, "You should learn to eat lentils for dinner, then you wouldn't have to flatter the king." And that's kind of been my philosophy on that. Although I must say I do enjoy the fine things every now and again.
Should other members of the establishment get involved, throw their hats into the ring and announce their political allegiances loud and clear?
Well, definitely. That's what happens in every democratic country. In the United States and in the UK, there are academics, administrators, who are supporters or members of different political parties across the spectrum. This is widely known and is a part of who they are. Some institutions and individuals, of course, are leaning more towards the conservative end, and some are leaning more towards the liberal end. But that's part of a real national conversation, hearing voices from the ground and from the establishment. And that happens all the time in developed political economies, not only for a limited time when the ruling party loses ground and decides it needs to let 100 flowers bloom. There are many in Singapore who have started speaking up, from Tan Jee Sey and Tan Cheng Bock. Now, Walter Woon, he spoke at an NSP meeting, and many others. Heck, even yourself, you're part of the media establishment, some more publicly than others. It's only good for Singapore that we get a diversity of views from those with administrative experience or academic knowledge. Then the citizens who actually hold the ultimate power can make more informed choices.
You were a member of the SDP's expert healthcare panel that recently published a national healthcare plan. Could you take viewers through the bare bones of the plans and the motivations behind some of the main principles?
The document is a huge one, though. It's more than 100 pages. The key issues, though, are 3. First, the SDP believes that basic healthcare is a universal human right. Thus, the plan provides universal and affordable healthcare for all Singaporeans. Secondly, we want to increase government spending on healthcare, closer to levels achieved by other developed Asian economies. Finally, we want a system which is sustainable and which can contain rising healthcare costs by strengthening medical audit. We believe that a universal health insurance-based system is the best approach to do this. By using mandatory health insurance with government payments for those who are unable to afford it, we can ensure that the risk is pooled. It's a bit like car insurance, but something that covers everyone, rich or poor, whether you can afford a car or not. With a government-run insurance scheme, we can also control costs by regulating what is covered on the basis of solid scientific evidence. We can also avoid cherry picking, which is what insurance companies do when they don't want to cover individuals with pre-existing illnesses.
Given that the plan is a rather groundbreaking document, has the government attempted to engage your panel on it?
Well, there has been no formal government response to the document, but there have been many informal responses to specific parts of the plan. For example, Dr. Amy Khor, the Minister of State, was reported in the Straits Times defending the 3M system. There have also been others who have supported certain elements of the plan from think tanks and academic bodies. Most recently, Dr. Jeremy Lim, who's argued for universal health insurance. And there are other health economists who have highlighted gaps in funding for care right now.
As someone who has been involved in healthcare at fairly high levels for quite some time, do you think that the current 3M system of Medisave, Medishield and Medifund are sustainable in the long term? And more importantly, does it meet the healthcare needs of a bustling first world nation in the 21st century?
Okay, I think it's important for people to realize that the 3Ms, or Medishield, Medisave and Medifund, account for actually a very small proportion of our current healthcare expenditure. If you take 2010, the last year for which we have official figures, Medishield accounted for about $400 million, Medisave $750 million, and Medifund for about $80 million. So that gave a total of about $1.2 to $1.3 billion out of a healthcare expenditure of $12 to $13 billion. So in other words, the 3Ms only account for about 10% of healthcare expenditure. Where does the rest come from? Well, about a third comes from government subsidies, but the remainder comes from employer-funded healthcare or out-of-pocket expenses. And there, I think, is the problem. See, with healthcare inflation actually being pretty runaway, look at the rate at which the cost of Medisave contribution has gone up. It's just not sustainable to expect employers to pay such high amounts for their employees' health insurance, or to expect individuals to pay out of pocket so much for their health care. And so any system that depends so much on employer-funded healthcare or out-of-pocket expenses is going to collapse at some point in time. Right now, we have less than 10% of the population who are over 65. That's going to change very dramatically in the next 10 to 20 years. And, you know, the way in which healthcare costs are going up, it's just simply not sustainable to depend on employers and the individuals to pay for healthcare, which is what the current healthcare system in Singapore is.
So if you could predict the future, what would the health of our citizens look like in, say, 25 years if we cling to the 3M system?
I think if we continue to depend on a system which depends so much on out-of-pocket expenses, the number of people who are missing out on basic and preventive healthcare will only increase. Healthcare costs will invariably spiral out of control, and the economy will be very badly affected. We've already started to see some of this. A study done recently in the Taman Jurong neighborhood by Professor Gerald Koh and his colleagues showed that significant numbers of individuals living in rental housing do not know they have high blood pressure, or if they know they have high blood pressure, they don't go for screening because they think that they can't afford it, and they don't go for treatment because of the costs associated with treatment. They will probably only end up in the healthcare system when they get complications of high blood pressure, such as a stroke. And as you know, that can be a disaster for an individual as well as for society as a whole. And all of this could have been prevented by ensuring that there is universal, affordable, basic primary health care funded out of an insurance system.
So I guess having taken a closer look at our healthcare system through your membership of the SDP's healthcare panel, what other areas of policy do you consider in need of an overhaul?
Well, the obvious ones are housing, education, and transportation.
Are you involved in any other policy work with the SDP?
Well, I'm involved in the education group because, as you know, I am involved in education right now. I asked to have a look at the housing policy, but I don't know too much about that. I'm just going to put in my 2 cents worth.
Professor Paul Tambyah, I want to thank you very much indeed for taking time out from your busy schedules to join us today. Your précis of the SDP's National Healthcare Plan has been easy to digest, and I hope it will give our viewers something to chew on.
Thank you. It's been fun.
Viewers, thank you very much for watching this episode of Let's Talk with Professor Paul Tambyah. The SDP's National Healthcare Plan can be found on the party website at www.yoursdp.org. If you would like to engage the party on the plan or want to find out more about its other policy initiatives or grassroots activities, do come down to Connect, the monthly open house at 12A Jalan Gelenggang, off Upper Thompson Road on the last Friday of every month, 7:30 to 9 p.m. For now, I'm Nadine Keller, and you've been watching Let's Talk. Goodbye.